Hello, and welcome to Ethics on Call, the podcast of the Center for Theology and Ethics in Catholic Health. I'm Dan Daly.
And I'm Tom Bushlack.
And today we're going to talk about the ethics of access to healthcare. And we are really glad that you are joining us today. This is our first episode, the first episode of Ethics on Call. And we're excited to be launching it and sharing it with all of you.
Yeah, really glad that you're all tuned in. Happy to be here with you. And we're going to talk about access to healthcare and a recent position statement that we put out through the center today. But in future podcasts, we'll be talking about recent scholarship in theology and ethics as it relates to Catholic health, news, current events, application, things happening in the world of theology, ethics, and Catholic healthcare. So look forward to tuning in and being with you all.
Yeah. And today, we'll take that deep dive into the access to healthcare. Tom, you wrote a great statements that we just put out last month in May of 2025. And so, let's get into it. So, Tom, the first question that I have is why now? I mean, as you know, this is not a new issue. It's not a new doctrine in the church is teaching. Why did you decide to write this piece at this point?
Yeah, great question. And there's kind of a two-part answer. And one is sort of the immediate situation. We're recording this as Congress is in the midst of the budget reconciliation progress and process, I should say. And, that there's a proposal on the table that some form is likely to be passed that is going to cut access to Medicaid in particular and to those Americans who are most vulnerable and most at risk of losing their health insurance. So there's kind of a current moment where this is becoming more poignant and relevant. Facts and figures that have been thrown around from the Congressional Budget Office estimate that by 2034, 10.9 million Americans could lose healthcare coverage. And then if you factor in as well the sunsetting of the enhanced premium tax credits under the Affordable Care Act, that number could go up another 16 million. So this is no insignificant moment in this debate. And so we felt, and you and I even talked, Dan, about wanting to think about the center, which is new. What voice can we be in that? A voice of hope and upholding this this ideal and core part of the teaching. So I think it's a particularly poignant moment. And then there's the bigger picture, which is this is even if we weren't in a moment of a particular budget proposal, right, that we just talked about, these issues are live and have been live in American culture for quite some time. They've been relevant to Catholic healthcare and its practice and where we stand in terms of advocacy. And whether or not the current budget proposals go through, or even if we had a different administration, this isn't about, taking sides, I don't politically. Even before this, we didn't have universal healthcare access, right? Even without these cuts. The Affordable Care Act certainly expanded, and then Medicaid state expansion expanded access. But even then, we didn't have universal coverage. So this is an issue that has been with us for quite some time and no doubt will be. And so we really wanted to think really deeply and theologically with and out of the tradition. Where do we stand now? And, regardless of what happens going forward, how do we keep that front and center of our public message about this is what we stand for and this is what we want to work towards? So it's a little bit of a both and in that regard.
So high stakes issue right now, but certainly an issue that has been with us for a long time and presumably will be for an extended period.
Yeah, and regardless of what political party happens to be controlling Congress or in the White House, like these are perennial issues and principles that we stand upon and advocate for, particularly those who are most vulnerable or economically poor that are most likely to be excluded. So that has always been a part of Catholic healthcare, and I think we'll talk about that over the course of some of that historical perspective, and then why we're continuing to uphold that going forward.
So Tom, in the very first paragraph, you begin the piece by appealing to Jesus' healing ministry
Hmm.
and kingdom of God,
Yeah.
and that kingdom that Jesus both inaugurated and is very person and preached. So,
Hmm.
what does Jesus have to do with all this?
Great
This bill
question.
that's before Congress and the issues that we've had in this country around access. You bring in Jesus here right at the outset. Why? What's going on there?
Yeah, and a perfect example of how this is so much bigger than the current moment, though it will, take different forms. But we talk about sort of the three ways that Jesus proclaimed the kingdom of God. That was his central message in the Gospels. Was that the opening public lines of Jesus is repent and believe, for the kingdom is at hand. Believe in the good news. And the three ways that Jesus witnessed to that in a very incarnational, embodied way is through preaching, teaching, and healing. And Catholic Health Ministry has always focused specifically on that healing ministry. So, as an official ministry of the church, there are other uh, dimensions or branches of that ministry that deal with preaching and with teaching. Catholic healthcare deals with the healing dimension of that. So, there are lots of stories that many of us are probably familiar with. My personal favorite has always been the story of the hemorrhaging woman that shows up in Mark 5. And oftentimes the parable of the Good Samaritan gets front and center, and there's good reason for that, right? That Good Samaritan was basically providing healthcare to a foreigner who should have been excluded in his culture. So that's a powerful story. What I love about the hemorrhaging woman, and I used to teach this to undergrads, is she was sort of the ultimate outsider, right? She was not Jewish. She was a Gentile of some, perhaps Syrophoenician, if I'm remembering correctly. Don't have the text in front of me. And I'm Catholic, so I don't have every word memorized the way some of our Protestant brothers and sisters do. But so she was an outsider. She was hemorrhaging, which under Jewish purity ritual law made her impure and untouchable. And then on top of it, no woman would ever touch a man in public in that time who wasn't her husband, her spouse, right? And she breaks every social taboo. And the scene is so beautiful because the crowds are pressing in on Jesus and he feels the power go out as she brings her faith to him and touches him and experiences the immediate drying up of her hemorrhaging. And Jesus stops and says, "Who touched me?" And the apostles are like, "What do you mean, who touched you? There's like 800 people pushing in on you, right?" I don't know that's the number I made up, but I'm not a biblical historian. But he immediately turns to her. And that scene, I think we miss how dramatic that scene is when we read it in our modern age, because I am fairly certain that when she admits to having touched Jesus, that she and everyone else in that crowd expects her to be stoned to death in that moment. She touched another man in public. She's a foreigner, like she did everything wrong, quote unquote. And he looks at her and says, "Your faith has made you well." And it is just so incredibly powerful. So, the ultimate sort of way in which God's grace is healing in and of itself, and we can think about that healing as spiritual, but for Jesus, it was embodied, it was incarnate.
Right.
It was her physical ailment, not only affected her physical health, but it meant that she was ostracized from every form of the community. And in healing her, he not only healed her physical ailment, which presumably could have killed her, but he brought her back into community and into relationship and restored her dignity, and even her capacity to participate. And what gifts be interesting to do, like a fictional, like what happened to her after that moment, like what gifts did she discover that she brought to the community that weren't possible before that healing. So that there are lots of other stories of healing in the Gospels, but that one to me is very paradigmatic.
So, one of the things you do in this piece as well, Tom, is you argue that the church is supports universal access to healthcare,
Hmm.
that everyone deserves access to care. And, I was wondering if you could just walk the listeners through Catholic social teaching on this.
Yeah.
Uh, who deserves care and why do they deserve it? What are the fundamental values, virtues, principles that
Yeah.
that animate this teaching?
Yeah.
Uh, and that we Catholics don't see healthcare as a commodity. Certainly, it's commodified in certain forms, but the access to kind of care that everyone requires to be a part of the community is certainly not something that is seen as a commodity. It's seen
Yeah.
as a right, as you rightly argued. So
Yeah.
to walk the listeners through what are those values, virtues, and principles in the social tradition that lead the church to this position?
Ooh, there's so many layers to this great
Yeah.
question. I'm trying to decide where to even start. But I think you're right to start by saying that the Catholic tradition, broadly understood, does not think of, and there's a quote from Pope Francis that explicitly says this, in that we quoted in the paper, that healthcare is not primarily a commodity, a good to be bought and sold. Now that being said, healthcare currently in its form is delivered as part of a marketplace, right? And that's
Mm.
just part of the reality that we live in. But it's helpful to understand why in the tradition we might recognize that those are the constraints within which we work in this particular time period in the early 21st century, but traditionally that has been seen through other lenses. And I think that could be helpful for us because we are so dominated by that market paradigm, which is another element of what Pope Francis, pointed out pretty consistently and challenged us to see beyond in his papacy. But to go back a little bit, um, I mean, you can go way back to we started with the gospel, and I was clearly a part of it. And in the early church, we have accounts, historical accounts, that one of the ways that as the gospel spread in the ancient world, the Greco-Roman culture at that time, um, and scholars have made this argument that one of the ways that Christianity spread was it, without discrimination, offered care and protection to people in, at that time, the Roman Empire, who might have been, um, excluded, weren't Roman citizens, uh,
Right.
slaves, people who were not considered property owners, or um, all kinds of people sort of disenfranchised. That the early Christian community band together and cared for those people. And we have Basil of Caesarea opening, in the early centuries of the church, what might be one of the first Christian hospitals as a bishop of that area of the world, and seeing that as an essential piece. And some scholars have argued that it was that very indiscriminate care that helped to spread the gospel, good news, at that time. Now that developed into some particular ways that manifested in Middle Europe, which is the tradition that we've inherited through monastic and other religious communities that founded forms of care. When we get closer to what we would consider modern Catholic social teaching, which has a lot of roots, right? Its roots intellectually go back to at least the time of Thomas Aquinas, but other great thinkers in the tradition, Augustine, some of his thoughts on the common good and things like that have all informed that. Typically, we think of late 19th century with Pope Leo the 13th. Interesting kind of side note, Leo the 14th signaling some continuity there with his
That's right.
choice of a new name for the new pope. Um, but Leo the 13th is often credited with starting modern Catholic social teaching in the kind of now systemized form that we think of it. Um, with Rerum Novarum in 1891, where he took a strong stance in the late kind of industrial revolution period in favor of workers' rights. And I went back and looked because I actually thought maybe the first articulation of healthcare as a universal right might have been in Rerum Novarum. I couldn't remember. I read all those documents in grad school and taught them, but you know, as you know, they're long and detailed and not always
Oh,
the
yeah.
most thrilling reads, but they're important. He mentions that workers should have access to social resources like care, but he never explicitly says it's a right. The first time that I was able to find that was articulated was Pope John the 23rd, who was, of course, the Pope who called the Second Vatican Council. And Pope Saint John the 23rd, I guess I should add. But he was the kind of the first to really say, no, this is a universal human right. Of course, that was around the same time as the UN Declaration of Universal Human Rights was articulated in 1948 after World War II, which also lists healthcare as a universal right. So it's sort of been developed, and I would say enriched over the last, what would that be? Can't do my math. 70 or so years since John the 23rd would have articulated that. So it's kind of gathered more depth and more richness as people have reflected on it. But it has that long tradition of being considered something that our vision of what it means to be a flourishing human person requires some kind of health care and care for the body and care for the soul. That looks very different in different societies and cultures, but that really has, I would say, only grown in our awareness of how important that is.
Okay.
Does that kind of get at the highlights for you, or I don't know if
It
you?
does, yeah. I mean, I think we can try to we can get to the conceptual aspects of it too. But just as you were talking, I was thinking, a lot of our listeners are people working in Catholic healthcare,
Hmm.
and you were really talking about the embodiment, that kind of the argument that Rodney Stark makes in that great book, The Rise of Christianity, that one of the primary ways in which the gospel was spread was through the practice of the works of mercy, particularly nursing the sick.
Hmm.
He makes the case that it might have been the most important practice in the rise of Christianity. It converted
Okay.
people simply based on the embodiment of the gospel
Hmm.
in those who provided mercy to the suffering and the sick. And it reminds me of the women religious who
Yeah.
founded the hospitals in the Catholic hospitals in this country. I mean, they provided care to everyone. They did not distribute it as a commodity, but rather they distributed it based on the needs of the people,
Yeah.
and they sought out those needs, right? They went to the frontier and they sought out those needs. And it just reminds me that, in some ways, it's always helpful to do the theology. As a theologian, we're both theologians. We know the importance of that, but what you're getting us to here is those embodied practices, are the saints, the communities of practice that have led us to take this position today, right?
Stories and yeah,
2025
there's
on access to care in the United States. It's very embodied. Now we do need to conceptualize it. So I'll ask you about that as well. But your answer really reminds me of just how embodied all of this is.
yeah, and your comments remind me of a piece that I didn't mention in my previous answer, but is so essential to this question now, particularly in the U.S. context. But you could apply this in other parts of the world as well, which is those founding congregations, primarily sisters that came to the New World. I'm indebted to my colleague Michael Miller at SM Health for pointing this out to me. There's this beautiful painting, and it's of the Ursuline sisters. I believe it's from the 1700s. They were the first sisters to arrive in the U.S. and kind of establish ministries of healthcare and education. And in this painting, you have the sisters going out and ministering. This was in Louisiana, near New Orleans. And in the image are all the people of that time that you would expect. There were the European immigrants and like the conquistadors in their garb. There were the poor immigrants who were eking out a living on the land. There were slaves, the black slaves, and there were First Nations, indigenous persons who had been there all along, and they're all represented in this. And the sisters in this painting are ministering to each of them directly. And what I love about how Michael Miller describes this is he says this is a picture of the first community health needs assessment ever conducted in the United States, which of course has a different meaning now. But he's right, in a metaphorical sense, that the sisters that founded this work and these ministries, they did not ask where people were from and whether or not they had health insurance because that didn't even exist at the time. They didn't ask about their immigration status. and they didn't turn away the wealthy and the powerful either. It wasn't like they tried to pick sides. They just said Jesus healed everyone who needed it, and we're going to do the same thing. And that has grown in some really powerful ways into these ministries that we now see across the US and other places that are that legacy that continues. And having worked in formation in a previous role, and knowing that that's a primary role that a lot of our mission leaders do in Catholic healthcare, it's really important that we tell those very specific stories, because
Yeah.
every single ministry has a story of a moment where there was a need in the community, there was nothing to address it, and a sister or group of sisters goes out and they rally the local politicians and the local business owners. And they worked with the Catholics and the non-Catholics, and they said, like, hey, there's a need. We're just going to do it. And somehow the resources showed up. And there still is that basic faith, even though the resources and the delivery and the science and the technology is so complex. There's still that animating faith that guides this. And I would say I want to inject into the current dialogue, because I talk to a lot of people who are scared and frustrated. And we got an update from the Kaiser Family Foundation about a poll that they did last week where, more than half of Americans are concerned that they or someone they know or love or a family member is going to lose health care because of this current bill. Um, so I want to inject that that faith, that hope, claim that even if we might be moving in directions that are going to limit care in the near future, that we continue to trust that this is possible and the resources are there if we can develop the sense of solidarity, that commitment to the common good, to see our neighbors who are different, including immigrants and others, as having that full human dignity, and that right to healthcare is based solely on that dignity, that cannot be, um, no circumstance can get rid of it, no matter what a person has experienced or has done. Um, we affirm that no matter what, and that's a really important thing for us to, I think, to hold on to in this time when people are anxious and we don't know where this is going to go.
Can you just walk us quickly through 2 or 3 of the concepts that you brought into the piece,
Yeah,
that can kind of conceptual framework that buttresses that claim that access to care is a universal human right
yeah.
that all persons, can make?
Yeah, I think it's a great way to think about how Catholic social teaching works in action, because you do have these basic principles, but how they're applied, and we say this in the paper, you know, the sort of universals are upheld in the tradition and these principles. Uh, but how those play out in a particular context is very dependent upon, the histories that we've talked about that are specific to our context, the current political climate and what's possible and how people can work together. So I think to understand those principles first and combine that with that sense of faith that this is possible, then move us in a direction of practical practices, policies, legal frameworks that we can advocate for. Um, so to answer your question, I think the first two that come to mind, and to me they always work in tandem, is dignity, human dignity, and the common good. So we've already talked about, the more technical language is the inviolable dignity of the human person. It cannot be violated. It can't be taken away. It can't be stripped or removed, no matter what a legal system or you know might say or do, or like, that's inviolable. Um, the common good, again, it's a term that we use a lot in Catholic theology, moral theology, Catholic social teaching. Um, I think it's a little harder for us to understand. It's easy to go from like human dignity to the concept of a right, but the common good then puts that into a broader social context. So, yes, we uphold the unique dignity of each and every human person, regardless of anything about who they are. Um, But that right and that dignity exists in a very social context in this tradition. This goes all the way back to Aristotle and Thomas Aquinas, that Aristotle said that we are rational social creatures, animals, social animals. We share that with the mammals. We cannot thrive outside of community. And so this idea of common good is not just some fun abstract thing that we want to throw around and make it a political buzzword. It's a real commitment to say we can't even envision a person having access to all their rights without a community that recognizes those rights, and has structures in place, political, legal, social structures, institutional structures that honor that. And so part of our commitment is to having those robust social structures that support that and honor that. Those, I think, are kind of foundational, and to me they're like two sides of a coin. They always have to work together, not just for Catholic healthcare, or not just for healthcare as a right, but for any of the principles of Catholic social teaching or any context where we might apply it. Then you get a little more into like the weeds or the details around, I think, subsidiarity and a positive role for government are two that we mentioned in the paper, and the preferential option for the poor and vulnerable. I think that one, again, if you've read the gospel, you can get the preferential option for the poor and vulnerable. And I should include the Hebrew Bible as well. Like, you know, it's pretty clear that when God acts in human history, God tends to act on behalf of those who are socially excluded or economically poor or vulnerable in some way. So, even though there's still people who argue with that or might find it controversial, from a scriptural theological standpoint, it's pretty straightforward. The one that maybe gets more difficult or technical, but does help us to move from the abstract to the concrete, are those points about there's a positive role for government, and then that notion of subsidiarity. So if you'll, and you and the listeners will indulge me for a moment, subsidiarity, I think, is one of the most misunderstood or easy to misunderstand, and it's kind of complex, but it's not like people can figure it out. It's hard. It's not something we think a lot about. So I always would, when I taught subsidiarity, I would always say there's sort of two dimensions to it. And one is the first one that everybody thinks of who has some familiarity with Catholic social teaching. And that's the idea that, subsidiarity says that issues that come up, so in this case, people who don't have access to healthcare, are best resolved at the most local level possible by those who are closest to the problem. Um, that's pretty easy, I think, to understand. Now, when you combine that with the other dimension of subsidiarity, the Latin word subsidium means help, subsidy, aid, right? So there's an understanding that, yes, in an ideal world, uh, everybody solves their problems locally, and within your city or your neighborhood or your town. But there's also the teaching, as it has developed, says there are certain things, certain issues that are so intransigent and complicated that they can't be adequately resolved at that local level. And so this subsidium, the aid, has to come from a higher level in society. And by higher doesn't necessarily mean better, but you could think of society is made up of a lot of different actors. Catholic healthcare ministries and institutions are part of that. Religious institutions, families, businesses. There are non-government parts to that. And then you get into your local city, municipality, county, and then up to state, and then up to federal levels, right? So subsidiarity says if you can't resolve an issue at one level, then the aid needs to come from a higher level. And to go back to Rerum Novarum and Pope Leo XIII, right? For him, the protection of the rights of workers against unjust discrimination and exploitation, in late industrial capitalism, said, we need the state to step in and protect these rights and guarantee them, because we can't just rely upon local business leaders and maybe ineffective local politics to be able to make sure that happens. So I think on some level, when we talk about healthcare and that idea that there is a positive role for government, doesn't mean government should solve everything. In the debates in the left and the right, we have a different moral visions of what the role of government should or should not be. But the tradition says that there's always going to be some positive role wherever we land on that. And I think let's try to wrap this up because I've thrown a lot out there, but it's important for how we think about this. You know, I think historically in the United States, and you think about the original passing of Medicare and Medicaid and the Great Society, we came to a point where we said we don't want to be the kind of people that let this many people not be cared for in our community. And so we developed those, and those came at federal and state levels, which are the highest levels in our current system. Um, Now, we can make all kinds of arguments about whether that's grown too big or how to make that. I think affordability is a huge issue, the long term solvency and viability. Um, those are important questions to ask. But subsidiarity would say I think there's going to be a role for government having a place in this alongside of private insurers and Catholic healthcare providers and everyone else in between. So I'll pause there. That was a lot.
Oh, that's great. I think, one of the things you just said at the end that really got me thinking was, you referenced the Great Society and other programs and the questions that we've asked in the past are, who are we as a people and who do we
Mhm.
want to become? So they're not, I mean, the questions of rights are deeply implicated in those questions, but they're also questions of moral character,
Yeah.
right? We would, as theologians, would talk about virtue. And can we think about a way that, how do we become the kind of people as Americans, if we can in a deeply divided partisan nation still talk about being an American? And I hope we can.
Yeah.
Um, how can American Catholics really invite those questions about whether it's rights or about character? What does it mean? Who are we?
Yeah.
In this day and age? Who are we with the children don't have access to care? Who are we the children don't have, enough good nutritious food to eat? I think, that we can think about many ways that Catholic moral theology or Catholic social teaching can help to kind of bridge those divides. And I think
Yeah.
one of the ways I think is we can ask those questions. We have that deep tradition and conceptual resources and frameworks that raise up these goods and ask us and really invite us to ask important questions like questions of rights that we've gone through, but even now as you're talking, questions of character. Who are we as a people?
Yeah, I love that you brought that up because yeah, rights. I'm gonna put on my nerdy ethicist hat here. Rights often get put into the category of like deontological ethics, right? Kantian sort of universal liberal ethics, broadly understood. Um, and then the character question about who are we, that tends to be more of a virtue question. And of course, all of these aspects of different moral philosophies are at play in the tradition. But I do think that is an important question that we ask. And again, even historically, as I said at the beginning, even if we weren't having this current debate about these multi-billion-dollar cuts to Medicare and Medicaid primarily, we've already asked that question in some interesting ways, right? We know that we have a system where not everybody has coverage. And we've put in stopgap measures like EMTALA, which I always forget how to say that full acronym, but part of EMTALA basically says that if somebody shows up in an emergency room, we have a duty to provide enough care to stabilize them, and not just say, "Too bad you don't have health care. You just need to lay on the sidewalk and let nature run its course," right? We've already decided we're not okay with that as a people. And I think I hope that has broad support among people from all different political ideologies, right? Now, what's interesting is that practice has raised some interesting questions. So we've made a choice that we're not going to do the work, or we haven't yet. I'm going to put it that way. That's more positive. We haven't yet figured out a way to go a little more upstream and say, well, wouldn't it be better if people had access to a primary care physician and healthcare that would allow them to not get to the point where their unmanaged chronic health conditions lead them to show up near death, often in our emergency rooms. Like, so that is not only, I think, it's a moral question. Who are we that we allow this to happen as a society? I feel troubled by that. I know many Americans do. Um, so there's a like, who are we question, and then there's the practical question, because that is an extremely expensive and inefficient way to manage people's health, right?
Mm.
When we wait to the point that someone is in crisis, that is not an optimal way to have a healthy society. And how many of those people, if they had access to care where they could see their primary care physician at least once a year, would be able to treat things upstream and then have enough stability in their life to show up at their job every day? I don't want to wade into the weeds around work requirements because that's so complicated, but that question is being asked. Are people more likely to show up and work and be productive if they already have healthcare and they're healthy, or if we cut them off because they're not currently able to find work? Um, there is a cost to that, and it might sound good as a political soundbite and make us feel better about holding people accountable. But does it actually work? And the cost is higher in the long run. The last thought I want to leave you with, because it popped into my head when you asked the question. Joseph Pieper, a Thomist philosopher from the early 20th century, um, wrote this great little book called Leisure is the Basis of Culture. And he says that if you want to understand the character of a people, well, he says this about individuals as well as communities. Look at what they're willing to sacrifice for. And what they're willing to sacrifice, and sacrifice can look like a lot of things. It could be time, it could be money, it could be resources, energy. That will show you what they care the most about, right? And so I think a question that we can be asking ourselves now and into the future is, are we willing to sacrifice and do the work that it would take to create a system where everybody has access? Um, and I want to say we can, and I want to ask that question and keep asking that question, and invite people who are concerned about that and want to commit to that to join in the dialogue, and the hard work that's going to take. Even if we were to start, even if I could snap my fingers and tomorrow all Americans agree that that should be the goal, it ain't going to be easy. That's going to take a lot of work. But right now we're at a point of, I think, having to build a little bit more of that consensus about who that's. I would say that I would be proud to say that's who we want to be as a people. And I think a lot of Americans feel that way, regardless of where they fall on the political spectrum. So I hope we can continue to invite people into that dialogue and to contribute to that process.
Yeah. Well, Tom, I think the piece that you wrote and that, that we've posted on the website, theologyandethics.org forward slash, well, that's the podcast. So go to theologyandethics.org and you'll find the piece there.
Under the media tab, if you, yeah.
I think what you've done is really helped Catholics, but all people of goodwill understand a perspective on this, and a really important perspective. And I hope that people go and read it and take it seriously. Would love to hear from you in terms of what you see there. But, thank you so much, Tom, for your time, for writing the piece.
Yeah.
And I really enjoyed the conversation. And our first podcast is under our belt, which is a good thing.
Yeah. Can I bring up one thing that I realized I didn't say?
Go for it.
I realized when we were talking about all the different principles that the one I didn't touch upon is that sense of solidarity, which is essentially that last soapbox that I was on about, who are we as a people?
Yes.
But that really is and it is a virtue, right? It's a character strength of saying that I'm committed to the good of my neighbor and to the common good. And so I think, to the extent that we can cultivate that sense of solidarity with our neighbors, again, regardless of whether they're employed or unemployed, or whether they're immigrant or legal citizen, that we can extend that sphere of moral concern and realize that we're sort of all in this together. Because I think that's another piece that, again, the devil's in the details about how we do this. But without that kind of commitment, I'm not sure we would have the moral fortitude to get there, or even the practical solutions that would be necessary that are very complex. So I just wanted to mention that piece. Yeah.
Yeah. Great.
And when you said a second ago that you invite people to comment, I think you were speaking to the listeners, not to me when you said you, correct? So I
No, it's
thought
yeah, we'd love to hear
yeah.
from the listeners. Yes.
Mhm.
Yeah.
Yeah.
So thanks, Tom. For Tom Bushlack, I'm Dan Daly, and this has been Ethics on Call. You can find this podcast on YouTube, Spotify, Apple, or our website, theologyandethics.org/podcast. If you're on one of those podcast platforms, would ask that you follow or subscribe to our page and leave a 5-star review and some feedback about the show. Would love to hear from you. We'll talk to you soon.
Thanks, everybody, for tuning in.